Cardiomyopathy. Introduction. Cardiomyopathy is a group of diseases that affect the heart muscle, myocardium, making it harder for the heart to pump blood to the rest of the body. It can lead to heart failure, arrhythmias, and sudden cardiac death. Cardiomyopathy can be inherited or acquired and may affect individuals of all ages, including children and adults. Early detection and management are essential to prevent severe complications and improve quality of life. Ejection fraction, F. Ejection fraction, F, is a measurement that represents the percentage of blood pumped out of the heart's ventricles with each contraction. It is an important indicator of how well the heart is functioning, particularly the left ventricle, which is the main pumping chamber of the heart. Normal ejection fraction, 55% to 70%. Borderline, mildly reduced 41% to 54%. Reduced ejection fraction, HFrEF, heart failure with reduced ejection fraction less than 40%. Preserved ejection fraction, HFpEF, heart failure with preserved ejection fraction 50% or higher, but still symptomatic due to filling issues. Definition. World Health Organization, WHO. Cardiomyopathy is a disease of the myocardium associated with cardiac dysfunction. American Heart Association, AHA. Cardiomyopathy refers to diseases of the heart muscle that make it harder for the heart to pump blood to the rest of the body and can lead to heart failure. Risk factors. Family history of cardiomyopathy or sudden cardiac arrest. Long-term high blood pressure. Chronic alcohol abuse. Viral infections that inflame the heart muscle, myocarditis. Metabolic diseases, example diabetes, thyroid disorders. Obesity. Autoimmune diseases. Smoking. Chemotherapy and radiation exposure. Etiology. 1. Genetic factors. Genetic mutations affecting heart muscle proteins. 2. Cardiovascular causes. Coronary artery disease, CAD, leading to ischemic damage. Hypertension causing heart muscle thickening. 3. Infectious causes. Myocarditis, viral infections causing heart muscle inflammation. 4. Toxic causes. Alcohol and drug abuse, toxic cardiomyopathy. 5. Pregnancy-related causes. Pregnancy-related, peripartum cardiomyopathy. 6. Endocrine causes. Endocrine disorders, example thyroid disease. 7. Autoimmune causes. Autoimmune diseases, example lupus, sarcoidosis. Classification. Cardiomyopathy is classified based on the structural and functional abnormalities of the heart muscle. 1. Dilated cardiomyopathy, DCM. Dilated cardiomyopathy is the most common type of cardiomyopathy. It is characterized by the enlargement and weakening of the left ventricle, leading to reduced ejection fraction and impaired pumping ability. The primary causes include genetic factors, chronic alcohol abuse, viral infections, and chemotherapy. Common symptoms observed in patients with DCM are fatigue, shortness of breath, dyspnea, swelling in the legs and feet, edema, and irregular heartbeats, arrhythmias. 2. Hypertrophic cardiomyopathy, HCM. Hypertrophic cardiomyopathy involves abnormal thickening of the heart muscle, particularly the interventricular septum. Despite this thickening, the ejection fraction may remain normal or even increased. The main cause is genetic mutations passed through families. Symptoms of HCM include chest pain, fainting spells, syncope, shortness of breath, dyspnea, and an increased risk of sudden cardiac death, especially in young adults and athletes. 3. Restrictive cardiomyopathy, RCM. Restrictive cardiomyopathy is characterized by the heart muscle becoming stiff and less elastic, restricting the heart's ability to fill properly during diastole. Although the ejection fraction usually remains normal, the filling impairment leads to decreased cardiac output. Causes of RCM include diseases such as amyloidosis, hemochromatosis, and sarcoidosis. Patients may experience symptoms like difficulty in breathing, dyspnea, extreme tiredness, fatigue, arrhythmias, and swelling, edema. For arrhythmogenic right ventricular cardiomyopathy, ARVC. In arrhythmogenic right ventricular cardiomyopathy, fat and fibrous tissues progressively replace the muscle of the right ventricle, weakening it and predisposing to dangerous arrhythmias. It is mainly caused by inherited genetic mutations. Clinical manifestations include life-threatening arrhythmias, episodes of fainting, syncope, and an elevated risk of sudden cardiac death, particularly in young individuals. 5. Unclassified cardiomyopathies. Unclassified cardiomyopathies refer to forms of cardiomyopathy that do not fit into the typical categories. One well-known example is takotsubo cardiomyopathy, also called stress cardiomyopathy, which is usually triggered by extreme emotional or physical stress. These forms may present with symptoms similar to other cardiomyopathies but have distinct causes or presentations. Pathophysiology. Initial myocardial insult. Downward arrow. Structural and functional abnormalities of myocardium. Downward arrow. Impaired myocardial contraction or relaxation. Downward arrow. Decreased cardiac output, systolic/diastolic dysfunction. Downward arrow. Compensatory mechanisms, RAAS and SNS activation. Downward arrow. Ventricular remodeling, hypertrophy, dilation, fibrosis. Downward arrow. Heart failure symptoms, dyspnea, fatigue, edema. Downward arrow. Progressive deterioration and complications, arrhythmias, thromboembolism. Clinical manifestations. Dyspnea on exertion and at rest. Fatigue and weakness. Edema in lower extremities. Palpitations, arrhythmias. Chest pain, especially in hypertrophic cardiomyopathy. Syncope, fainting, especially during exercise. Ascites and hepatomegaly in advanced stages. Sudden cardiac arrest in severe cases. Diagnostic evaluation. Medical history and physical examination. A detailed assessment of symptoms, example chest pain, breathlessness, fatigue, family history of heart diseases, and physical signs like edema, murmurs, or irregular heartbeat. Electrocardiogram, ECG. A test that records the electrical activity of the heart to detect arrhythmias, conduction abnormalities, and signs of left ventricular hypertrophy. Echocardiogram. An ultrasound of the heart that evaluates heart chambers, wall thickness, pumping ability, ejection fraction, and identifies valve issues and abnormal muscle motion. Chest X-ray. Imaging to check for enlargement of the heart and fluid accumulation in the lungs, pulmonary congestion, indicating heart failure. Cardiac MRI. Provides detailed images of heart muscles and structure, helps detect fibrosis, scarring, or infiltrative diseases, and assesses ventricular function. Blood tests. Includes B-type natriuretic peptide, BNP, for heart failure severity, and tests to detect infection, inflammation, or metabolic causes, like thyroid function. Genetic testing. Recommended in familial or inherited cardiomyopathies to identify specific gene mutations, aiding in diagnosis and family screening. Cardiac catheterization and coronary angiography. Invasive procedures used to evaluate blood flow in coronary arteries, measure pressures inside heart chambers, and rule out coronary artery disease, CAD, as a cause. Holter monitoring. A 24 to 48 hour portable ECG monitoring to detect intermittent arrhythmias or conduction problems not visible during a routine ECG. Medical management. ACE inhibitors/ARBs, angiotensin II receptor blockers. Examples: enalapril, ramipril, ACE inhibitors, losartan, valsartan, ARBs. Action: help reduce afterload, vascular resistance, improve cardiac output, and prevent ventricular remodeling that worsens heart function. Beta blockers. Examples: metoprolol, carvedilol, bisoprolol. Action: slow heart rate, reduce myocardial oxygen demand, and improve survival by reducing stress on the heart muscle. Diuretics. Examples: furosemide, loop diuretic, hydrochlorothiazide, thiazide diuretic. Action: help remove excess fluid, control edema and pulmonary congestion, thereby relieving symptoms like breathlessness and swelling. Aldosterone antagonists. Example: spironolactone, eplerenone. Action: block aldosterone, reducing fluid retention, prevent cardiac remodeling, and improve survival in heart failure. Antiarrhythmic medications. Examples: amiodarone, sotalol. Action: used to control abnormal heart rhythms, arrhythmias, and prevent sudden cardiac events, especially in patients with ventricular arrhythmias. Anticoagulants. Examples: warfarin, apixaban, rivaroxaban. Action: prevent formation of blood clots, thromboembolic events, especially in patients with atrial fibrillation or very low ejection fraction. Inotropic agents. Example: digoxin. Action: improve myocardial contractility, pumping strength, in patients with severe systolic dysfunction and reduce symptoms of heart failure. Surgical management. Implantable cardioverter defibrillator, ICD, prevents sudden death due to arrhythmias. Cardiac resynchronization therapy, CRT, synchronize ventricular contractions. Septal myectomy, for hypertrophic cardiomyopathy. Heart transplantation, end stage, refractory cases. Left ventricular assist device, LVAD, as a bridge to transplant or destination therapy. Rehabilitation and supportive care. Cardiac rehabilitation, improve functional capacity and quality of life. Nutritional counseling, low sodium, low fat, fluid restriction. Smoking and alcohol cessation programs. Psychological support, counseling for depression, anxiety related to chronic illness. Patient education, medication adherence, lifestyle changes, recognizing symptoms of worsening heart failure. Nursing management. Nursing diagnosis: 1. Decreased cardiac output related to structural heart changes. Monitor vital signs, heart rhythm. Administer medications as prescribed. Educate on activity limitations. Nursing diagnosis: 2. Excess fluid volume related to impaired cardiac function. Monitor weight and intake/output. Administer diuretics. Educate on fluid and sodium restriction. Nursing diagnosis: 3. Activity intolerance related to fatigue. Plan and pace activities. Provide rest periods. Monitor oxygen saturation during activity. Prevention. Control of hypertension, diabetes, and other risk factors. Avoid alcohol and drug abuse. Regular exercise and weight management. Genetic counseling for families with a history of cardiomyopathy. Heart-healthy diet, low in saturated fats, sodium. Routine cardiac check UPS, especially if high risk. Complications. Heart failure. Arrhythmias, atrial fibrillation, ventricular tachycardia. Thromboembolism, stroke, pulmonary embolism. Sudden cardiac death. Valve dysfunction. Cardiogenic shock. Conclusion. Cardiomyopathy is a serious cardiac disorder with potentially life-threatening outcomes if left untreated. Early diagnosis, appropriate medical and surgical management, lifestyle modifications, and patient education are crucial for improving prognosis. Nurses play a vital role in monitoring, patient education, and psychosocial support, making a significant impact on patient outcomes and quality of life.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.